Welcome back. 642. Type 2 diabetes can be deadly if left untreated. And according to a study by the National Library of Medicine, those affected are also 4 times more likely to get an amputation. Our chief medical correspondent, Dr. Corey Hebert, is here to weigh in on all of this, some other health headlines. Sir, good morning to you.
Good morning.
With that story involving diabetes, it's not the what that's the concern here, it's the who it's affected, right?
Of course. And you know, one thing that really gets me about diabetes is that this is a disease that you can really manage if you pay attention. First of all, you have to go to check your numbers. People know all their lottery numbers, right? But they never can tell you what their hemoglobin A1C is or what their blood glucose numbers are because they don't want to think about it. I'm telling you, it's one of those pesky things that sneaks up on you. But what we found is that if you don't get your numbers checked, if you don't go to the doctor, if you act like you don't have diabetes, then you can lose a limb. What we saw is that we've had a huge increase in the amount of people getting their limbs chopped off, and that means toes, legs, arms, all these things. But if you're African American or Latino, you're 4 times more likely for this to occur. Now, there are several reasons that people say, you know, you don't have as much access to care. You know, you have this inherent distrust of the medical establishment. I understand all that. But the point is, these are your limbs. And we can no longer just act like you don't have diabetes. You can't eat what you want to eat. You can't just act like you don't have this horrible disease, because not only as you get older, you get what's called PAD, or peripheral artery disease. What happens is that you're not able to get as much blood flow to the area of your legs and to your arms, most likely your legs. And then what happens is that the high sugar destroys the nerves, then you get a cut. The cut doesn't heal because you don't feel it, and then you lose your limb. So this is a major issue.
What's really interesting about this, doctor, is that it's not a new phenomenon to say that diabetes affects people of color more so than it affects others. You juxtapose that, however, to right now where you see people eating better, making better eating choices. How is it that we're seeing amputations among Black and Latino communities increasing among those who are diagnosed with diabetes, while also seeing people making more healthful food choices?
Yes, because I think by and large, and I hate to be this way, but are we really making those healthy food choices? I mean, there are more healthy food choices out there, but I don't know how many times I've been to a cookout, whether it's African American, white, or Hispanic, and everybody's eating horrible food and drinking horrible liquor, and that's just the way it is. And I feel that this is a problem because obesity has gone through the roof, which means that we're eating not healthy things.
So we got to be mindful of that.
Absolutely.
Also, a lot of rumors going on out there about the measles. We've got 2 confirmed cases here in Louisiana.
Yeah. This is a problem. I mean, I can fight this fight. You know, people think, you know, they don't want to get their children vaccinated. Well, now this is what happens when you don't get your child vaccinated.
And those children weren't vaccinated.
Exactly. Now, you think about COVID being contagious, right? COVID has an R0 of about 2, which means that if you're in a room, 2 people have it, then, I mean, that 2 people get it if 1 person has it, right? Because of the R0 being 2. If you look at the R0 of the measles, it's 18. It's one of the most deadly diseases known to man. And not only can you get the high fever and you can die from subacute sclerosing panencephalitis, say that fast 3 times, but you can also get just a really horrible illness, and you can die from meningitis. You can die from you having infections that go throughout the body, that you can just really have a bad time with this. But not only do you have this issue, but if the measles, mumps, rubella is a shot, right? It's all 3 of those things. So if you don't get the measles, mumps, rubella shot, if you get the mumps, you can get orchitis, and then you can, that's when you have an infection in your testicles and you can't have children when you get older, or you can get rubella. And now if you're a woman that's pregnant and you're not rubella immune, meaning you have not gotten the vaccine, then your baby inside can get rubella and then die in utero. So you have to get the measles, mumps, rubella shot. And look, if you don't know your history, you are doomed to repeat it. This was a horrible disease back in the day, and you need to get your children vaccinated to keep our levels up of vaccination across this state. It's very important.
All right, very important. Also, the man of the people letting us know what we need to know. Dr. Corey Hebert, sir, thank you so much. And of course, you can find these and other health topics, that is, on our website for you. You know, say that 3 times fast.
Exactly.
On our website for you this morning, WWLTV.com.